All right, YouTube. In more positive news regarding Trump, flag-burning tweet aside, he has picked Tom Price for Health and Human Services. Now, Tom Price is one of the foremost critics of the ACA and essentially wants to lay waste to it. I think you see a Trump that now is positioning himself to take this particular issue to the forefront over his first 100 days or thereabouts, which is good, actually. The ACA has been a complete disaster. I said several years ago when it was first implemented, it would fall short, it wouldn't do well, it would be a hyper-partisan issue. The thing about the situation is Trump doesn't gain anything from salvaging the ACA. The Republicans would cry foul and say, no, we want it repealed entirely. The Democrats aren't going to give him credit because they already hate him. The only way he makes headway is by scrapping it and by replacing parts of it, scrapping parts, replacing other parts, and keeping intact only the two provisions he's already mentioned, which I happen to agree with: pre-existing conditions and continued coverage under parental plans till the age, I think, of 25 or 27 or something. Those provisions are popular. Most Republicans support them. Certainly almost all independents support them. From a political standpoint, it makes sense to retain them. Those were the aspects of Obamacare that even early on, people far, far to the right supported these concepts. What the ACA lacks is allowance of interstate competition. It didn't include tort reform. It didn't include negotiating on drug prices. If it had included these things, then the ACA honestly would be doing fairly well. It wouldn't be as hyper-partisan. It would be at least moderately more approved of than disapproved of, which is the opposite of what we actually see. I think there's a 10-point gap whereby people disapprove of the ACA, and that's been a stubborn level. That includes virtually all Republicans, most independents, and at least a small sliver of Democrats. These are your several million Rust Belt voters that defected to Trump and gave him some of these states: Michigan, Wisconsin, Pennsylvania, and buffed him up in places like Ohio, Indiana, maybe doing better in Minnesota, parts of upstate New York, and so forth. There's where that extra gap is. These are largely middle-class Democrats, union labor that's tired of the ACA. The ACA does need to be massively overhauled. You don't have to scrap it. What you simply do is displace it. You write a new bill containing the provisions you want that strikes out the old ACA, which is too long for anyone to even humanly understand, and replaces it. That's all you have to do. You can keep those two provisions intact, inject interstate competition, negotiate drug prices, introduce at least mild tort reform. The price of goods and drugs and so forth will drop. The price of coverage will drop, commensurate with what it is now. You will see a massive drop in the price of health insurance. That was always the proper solution to getting more impoverished individuals onto health insurance plans. For instance, the mandate of sort of these minimal coverage things is retarded. People should be able to have extremely cheap plans to simply participate in having health insurance at all. Maybe it's what they want. Maybe they don't even like the concept of health insurance, and certainly there should be no fee or tax or whatever you want to call it on people that don't. Because a lot of the people that aren't on the ACA that have to pay that fine, they're really poor. And in their state, there's not enough competition to offer them a plan that they can even afford. They'd rather pay, 2.5% or whatever it is of their income, which is, tiny anyway. They'd rather get less of a rebate at the end of the year. The Supreme Court only ruled the ACA constitutional in the first place when Roberts said, oh, yeah, well, of course it's legal. It's a tax. That's what the ACA boils down to. That's how it got accepted in the first place. The ACA, if it hadn't been labeled a tax by the Supreme Court, would have died there. It would have been completely destroyed. There wouldn't have been an ACA anymore. Honestly, I wasn't expecting them to do that. I expected them to just say enough is enough and tear it up anyway. I was wrong on that count, unfortunately. It would have been better for the country. You have right now, Obama's legacy is dirt. Because his two signature bills, the ACA, which went through, became wildly unpopular, and is probably dead on arrival as soon as Trump's inaugurated, which is good. With Tom Price there as health secretary, yeah, it's basically dead. He might retain some of the other provisions. That's about all. He'll inject new ones that are more, I guess, free market friendly, and that'll be that. It'll lower prices, it'll get more people onto insurance. It'll actually work. It'll do what the ACA was supposed to do without a tax, and it'll do it a hell of a lot less expensively. It'll be wonderful. Honestly, we actually will have healthcare reform in this country that'll be better than the old system we were using, or the ACA's sort of weird mixed model China-style sort of way of working. It'll actually be good. Putting Tom Price there convinces me that he's probably serious about overhauling the ACA, and it's not as complicated as people think. You don't need to go through the ACA line by line, look at every regulation, every line of legalese there, and figure out how to reform it and rewrite the whole thing. All you need to do is slap it down and replace it with a new piece of legislation seamlessly, so that the insurance of those covered under the 25 or 27 provision, under adult insurance, under a parent's insurance, as well as pre-existing conditions, don't lapse. The big worry about simply saying fuck the ACA, scrapping it and starting over, building up from the ashes, is that the insurance for several million people would immediately lapse. Some of these people would be on death's doorstep. They would actually begin dying. From a human rights perspective, it wouldn't be good. From an economic perspective, it would be useless. It would take more time, and it would also significantly decrease Trump's popularity when stories of people who died because their insurance lapsed, the insurance that they were then able to gain under Obamacare, began literally getting sick and dying off. It would be a disaster for Trump if he were to simply scrap it and then after start building it again. He has to displace the bulk of the ACA with a new bill. He's capable of doing this. It could be a 20, 30-page long document. It doesn't need to be thousands of pages long. It would be more simplistic. It would be much more user-friendly. It would be more pro-competition. You're actually looking at, for the first time in a long time, the government putting something into place that brings back capitalism where it's lacking, which is good. The other piece of signature legislation for Obama was the TPP, and of course, that's dead too. Schumer comes out and says, no, we're not even going to bother trying, because we don't have the will of the House. The Republicans will block it. So that's dead too. So both of Obama's main pieces of legislation are dead, or will die, have been disasters, not even necessarily that well received by even some members of his own party. He's a lame duck at this point. I know he's planning some last-minute pardons of people who have given him money through some Clinton slush fund. That happened when Bill left too. That'll happen in the last weeks of his presidency, starting in late December. Obviously, he'll pass some executive orders to screw around with things. He'll get the bureaucracy to try to do the same thing, institute new rules. Trump's going to have his work cut out trying to get rid of all of that crap, but he can. He will have the power. He'll have the Senate and the House. So this would be something I look forward to, seeing Tom Price there. I don't care about any of his other opinions. Simply going after the ACA would benefit millions of people in this country. Long term, it would bring much more success at a much lower cost than what Obama designed. And you've got to realize something. Listen to Gruber talk, one of the main architects of Obamacare. He pointed out straight and clear at a meeting that he didn't, of course, want this revealed to the public, that yeah, the people had to be fooled in order to tolerate what was essentially a tax, as billed as healthcare reform. That's what he said, in his own words. And he's doubled down on this several times thereafter. It's actually very funny. He came out, I think, a week or so before the election, remember, Jonathan Gruber, and was talking about how the Obamacare, in order to survive when Clinton, he thought, would be inevitably elected, would need a stiffer penalty that was less easy to avoid as well, which really, I think, probably had something to do with the reason why Trump cracked the Rust Belt at a higher than expected total, because people there don't approve of the ACA, generally speaking. They're disdainful of it. Here in Vermont, we have our own state exchange. There's no competition here in the state of Vermont. That's why it's fucking expensive. It doesn't work. Get rid of the state-by-state exchanges. Have one exchange for all health insurance companies, as well as state provisions if they want to provide some sort of competing system. Get competition into it, and the prices go down. And you will have rock bottom level plans, to some $10 a month plan that covers basically nothing and just puts you on the exchange at large. Okay, well, if somebody wants to purchase such a so-called junk plan, which is what Obamacare sought to destroy in the first place, there's a reason that those existed, because there was demand for them to exist. Some people wanted some basic health insurance coverage, and they didn't want to pay through the nose for it. They should be able to purchase such a plan. I understand public health can be a concern if you have large segments of society without adequate access to medical treatments, to medications and so forth, and for preventative medicine especially. You can get epidemics, you can get all sorts of problems, you can have a less productive population. But the answer is not to tax people and compel them to buy plans that aren't any better than the old plans and cost twice as much because there's half the competition. That's not the solution. The solution is more competition, tort reform, and negotiating drug prices. How would it be? Some of these people, they're paying $1,000 a year for their medication. Wouldn't they like to pay $100 a year for their medication instead because there's no monopoly? And preferably, this would be paired, and this would be my advice to Trump, go after copyright law, pharmaceutical copyright law, allow much more in the way of generic drugs, loosen some of the regulations on their production, and their cost will fall even further. You might think of copyright reform as well for the literary world if you wanted people like myself to love you instead of just tolerating you based on the fact that you happen to be the better candidate. That would be nice. Yeah, it shouldn't be like, 74 years past death for the author or something like that. It's insane. You've actually got works, because they were translated, that are still not in public domain, that were written in the 1900s. Like as in the 1900s, like 1902 or something like that. It doesn't make any sense. Music the same way. So why aren't the Beatles in the public domain yet? We're talking more than half a century ago. It's ridiculous that this would be the case. Make it 20 years or something like that. There's no need to have it the way it is now. Movies, same thing. Oh yeah, some Frankenstein movie from the 40s. Oh yeah, it's still copyrighted. Oh, we're going to give you a copyright strike if you watch it. It's ridiculous. But yeah, Trump's pick of Tom Price is better than his flag-burning tweet, let's face it. That's about all. Peace out.